Hello and welcome to episode 2 of the Age Well Health Coach podcast. So it's been, and again, a little while since I made the last episode, and the reasons for that will probably become evident throughout the course of this episode. But I am really recommitting to making regular episodes because I think the messaging around health really needs to get out there, and I am aiming to do that as of today. So today I want to discuss health, in particular the definition of health and what it has come to mean in the 21st century. So I have got a script in front of me because I wanted to be quite succinct in the messaging that I want to get across today, and also I don't want to go off at a tangent. So if you see me sort of looking down, I am looking at a script that I have written. It's not AI generated, I have written it myself. So what has health come to mean in the 21st century? And it's interesting to also look at the history and historical aspects of health and healthcare, which I'm also interested in. So I just wanted to pull together some principles of health so that we can think and reflect on what health means in general and also what it means to us as individuals. So in terms of etymology, which is the origin of the word, health means wholeness, being complete and undivided. So this is really interesting when we think about words that are used and language that is used in relation to health. So holism, holistic health. And holism is something that is often used quite often, but I think without a proper understanding of where the word comes from and what this term actually means. Now, the word holism comes from the Greek word holos, which means whole. So we can see that when we look at the etymology of some of the language used, like health, like holism, they actually mean the same thing, which I thought was quite fascinating. So the verb of health is to heal or to healthen, which means making something whole. So we've got this theme around wholeness. So, the sum of, the whole individual as opposed to the sum of the parts. And we know that, and equally, and I can see why in science and health and medicine and in nursing, sometimes we have to break things down to be able to learn. We can't look at the whole human, biological system as a whole. We need to break it down to be able to learn it, but we need to put things back in place as a whole to see how things work interconnectedly and how we are placed in our environment, how we respond to and live alongside as we are part of nature, for example. So it's thinking about the human body, the human being as a whole. So in nursing, we do strive to provide holistic care. We talk about this quite often in nursing, but from my observation as a nurse educator, and I often ask students what is their definition of holism, what is their understanding of holism. And the answer that I tend to get is, it's physical, mental, social health, or it's psychosocial, or it's biopsychosocial, which is not wrong. But if we look at the absolute sort of definition of holism, it also includes spirituality, and for some it also includes metaphysics as well. And I'll come on to discuss what that means. So additionally, health is not a static noun, but it's a dynamic verb. So health is not a fixed state, it's dynamic. And we know that if we look, if we even reflect on our own life, from when we were very small to whatever age you are now, you can see that your life, your health will have gone through many changes, and there will be significant periods within your life where that is more evident. So, for example, puberty, pregnancy, menopause. There are certain aspects of aging and getting older where things will change. And that is normal. But health is more than the absence of disease. And, within the current healthcare system, we can be very disease focused. But it's more than that. It's about living well. So Hippocrates, who is often referred to as the father of medicine, reputedly said that the greatest medicine of all is teaching people how not to need it. And this is where my passion for health coaching and nursing really comes to the fore, and I am really passionate about becoming more health focused. And this can be referred to as salutogenesis, so being health focused, where often in healthcare we can be disease focused, which is pathogenesis. So I have been, quite vocal in the past within my profession about the need to be more health focused. But health is an individually defined phenomenon, and the determinants of health. So in nursing, we often teach about the social determinants of health. What determines somebody's health? And this is often dependent on lifestyle, personality, psychological and social characteristics, social conditions. If we think about some of the conditions that people live in and are social within, if we think about poverty, if we think access to healthcare, if we think access to good nutrition, good food, daylight, green spaces, this can absolutely and adversely potentially affect somebody's health. And the physical environment as well is important. The World Health Organization, so many people will be aware of the World Health Organization as a global organization that determines certain things that we do within health and healthcare globally. So they have goals, health goals that certain countries are encouraged to meet, and they can identify areas of research within health that can determine the certain course that certain places can take, certain countries and governments might take in terms of the population health. But their definition of health is quite interesting. So they define health as being a positive state of physical, mental and social well-being. Fair enough. But in my opinion, I don't feel this goes far enough. I don't feel that this is holistic enough. There's no mention of spiritual health, for example, or emotional health. Now, with emotional health and emotional intelligence, it can be part of what we refer to as mental health. But I see emotional health as a separate layer in itself. So I see health as layers. And emotional health, I don't feel has enough focus within the health sphere, because it's very, again, individualistic, isn't it? But if we think, emotions can be a physical response to an external stimulus, and it can be useful to understand how you respond emotionally to certain situations, for example, and how that might affect your health. But in terms of spiritual health, so nursing as a profession was very much steeped in spirituality historically. Okay, a lot of nursing took place by people who worked, so for example monks who worked within an abbey, or people who worked within more sort of religious based organisations. That's where a lot of care of the sick and the infirm took place. But spirituality is one of those aspects of health that means different things to different people. So it can mean religion, it can mean a spiritual practice such as yoga, for example. For me personally, my spiritual health is determined by how I connect to myself, to others and my environment, how I connect and how I relate to nature. That is what spirituality means for me. For somebody else, it could be something completely different. It could be somebody who is an artist or a musician, and that is what informs their spiritual practice, their spiritual health. And, it's quite interesting that spirituality is not in the World Health Organization's definition of health. For some people as well, it can be metaphysical, which is becoming more common, I would say, and people are taking more interest in metaphysical aspects of health. So metaphysical means transcending physical matter or laws of nature. So for example, it could be working with energy, it could be working with sound frequencies. So these are some of the, so for example, I'm becoming more and more interested in quantum healing and quantum science. I'm very much a novice. I'm just reading a book by David Bohm at the minute, and it's really interesting. And in fact, one of the chapters I've just read is talking about the holistic use of language, which is why I've started off with the definition of health. And, I'm quite interested now in the use of language in the health sphere as well. So it's just to give you an idea of what we mean by holistic, okay? Now, as a nurse, it would be remiss of me not to talk about Florence Nightingale. And Florence Nightingale, who is touted as being the founder of the nursing profession as we know it today. And I don't know if you can see in the background, I've got quite a thick autobiography just behind me about Florence Nightingale. She's a fascinating individual, and I think as a nurse, it's important to know historically where nursing comes from. But she had a really interesting take on health on a book that she wrote in 1859 called Notes on Nursing. And I'm going to give you just a short quote from that book on her view of health. And she starts by saying, "What nursing ought to do. I use nursing for a want of a better. It has been limited to signify little more than the administration of medicines and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient." So I thought that was really interesting. So back in 1859, which arguably isn't that long ago, but she recognised when she went out to look after the soldiers during the Crimean War in Scutari Hospital, that the soldiers were actually dying because, not so much as because of their wounds, but it was because of the environment in which they were being looked after. And she fought to ensure that the soldiers actually received these sort of determinants of health. So she recognised that the soldiers were not getting adequate sort of fresh air, exposure to daylight. The nutrition, the food that they were serving the soldiers was awful. Hygiene and sanitation was awful. And she and a small team of nurses went out to improve conditions. And she brought the knowledge that she learned through working at Scutari Hospital back to England. And there she spent the rest of her life campaigning for better environments in hospitals for patients to be looked after. So I thought she was a really fascinating figure. She often gets not dismissed, but I think, misunderstood potentially. But I think that she's, her notes on nursing and some of her ideas are still very much relevant today. Another nursing theorist that I've been reading about, and I've ordered quite a few of her books recently, is Jean Watson. And Jean Watson is a really renowned nursing theorist, and she's still with us, and she's still writing, and she's still doing a lot of work around caring science and nursing theories. And in 1985 she actually wrote that a healthy person has a high quality balance of life. So she looks at health from a very much through a holistic lens. And she says that, health is a sense of happiness, but it's also the ability to adapt to change. And she also went to observe that the definition of health and illness has changed. And we're now at a point, now she wrote this in 1985, but I think this is really relevant and more so now. She observed that any dissatisfaction, dysfunction, or psychological problem is now an illness. So, there are some conversations going on currently within the health sphere, as I call it, about over-medicalising everything, okay? We tend to medicalise life in general, and this is not healthy, okay? And I think, and I know from personal experience, that being able to take control and responsibility of your own health is really empowering. And, the medical health Organisations, professions are there to support us when we need it, absolutely. But I think there's an over-reliance and an over-medicalisation of life experience. And you feel free to disagree with me, but I'm going to give you an example. So if we take the current example of menopause, okay, so perimenopause and menopause, which is it's gained a lot of interest in the last couple of years, which has raised awareness, which is great, okay? But it's also become medicalised. We've medicalised essentially a natural physiological process. It's something that all women go through at a certain point in their life, some earlier than others. So around about the age of sort of mid-40s to mid-50s, you know, what happens is hormones, the sex hormones, will start to reduce and fluctuate. So during the perimenopause phase, there's a fluctuation of hormones, which can cause symptoms, and some of those symptoms can be quite severe, can be quite, challenging, and can affect quality of life. So as an example, and I'm going to give myself as an example here, because I am 51 this year, so I am in the phase of perimenopause, and I know that because of my age and because of my menstrual cycle and certain signs and symptoms that I've noted, that I know I am in perimenopause. Okay, I've not needed to go to the doctors to get hormone levels, because that just tells you the levels of your hormones at that time and place, and we know that they fluctuate, so that not going to tell me anything. So I know my body, and I know that I am in perimenopause. And in the last 12 months, I've been experiencing, and I didn't make the link to perimenopause initially. I started to note symptoms in my musculoskeletal system. So what I started to notice was that I was getting aches and pains that were more than just stiffness from a really heavy workout, for example. It was taking me longer, and it has been taking me longer to recover after a training session. So for my movement exercise routine, I do strength and resistance training. I was really enjoying doing some long walks and occasionally going swimming and yoga, mobility. Okay, so I sort of mix and match things that I do, but strength and resistance training is the one that I enjoy the most. I have to push myself to do the cardio, but that's just me. But I was noticing that it was taking me a lot longer to recover. So rather than getting the usual aches and muscle aches for a day or two after exercising, it was more like a week, or I just wasn't recovering at all, even with factoring in rest days. So I started to do a little bit of research, and in the last couple of months, I've started experiencing issues with my left ankle. And because I've got a really good understanding of anatomy, sort of did a little bit of tracking, looked at a little bit of sort of the anatomy, and I have got what is called posterior tibialis tendinopathy. So it's a tendon that runs under the foot, along the outsides of the ankle and up into the calf. And I was starting to experience, swelling and pain, even after just a short walk. So this was a bit of an alarm bell for me. I was thinking, what's going on here? Again, I can go to the GP and I can speak to the GP, and I've not ruled out that option, okay? So that's still an option there for me. But what I like to do is I like to look at where I am currently in terms of my health and lifestyle, and see what changes I need to make and any tweaks that I need to make to see if that makes a difference first. So just as a bit of background, 70% of women, so 70% of women will suffer with musculoskeletal symptoms, and concerningly to me, they can often be misdiagnosed as fibromyalgia and more recently long COVID, okay? So they can be not dismissed, but I would say misinterpreted. So I teach musculoskeletal health to undergraduate and qualified nurses. And I always ask the question when I teach anything, what is your knowledge around this subject? How confident do you feel looking after somebody with poor musculoskeletal health? Is it something you think about? Is it something you factor in when you're looking after a patient? And a lot of nurses will say that this is the system that they feel the least confident in. The reason for this, I think, is because we tend to refer and rely on our physiotherapy colleagues. So physiotherapists are fantastic. This is their bread and butter, okay? But interestingly, so I did a bit of a sort of literature search in the last couple of weeks because I was doing a little bit of research for my own health. And I found an interesting article in a physiotherapy journal and it was a qualitative study that was looking at physiotherapists' knowledge around perimenopause and menopause in relation to musculoskeletal health. And what the people that were interviewed observed is that although they had a lot of knowledge in relation to musculoskeletal health, they had little knowledge in relation to perimenopause and menopause. And so they were unsure as to what advice to give to a patient or client. So they would often refer that person back to the GP or, the practice nurse. So what I visualized in that scenario is a patient, so an individual who is having symptoms and concerns about the health just being battered from one person to another, one service to another, and maybe not even getting to the root cause of what is causing the symptoms. And as I said, it can be quite debilitating and it can affect your quality of life. So the reason why menopause affects musculoskeletal health, and when I say musculoskeletal, it's more than muscle and it's more than skeleton. Okay, so there's a decline in the hormone estrogen, and this affects joint health in many ways. Okay, so it can affect joint health because of the reduction of synovial fluid. So I'll take the knee joint as an example. So that's the synovial joint, and there's fluid within that joint which helps to keep it lubricated. So we have decline in estrogen levels, it can affect the synovial fluid levels. So we might have joint issues. Bone density starts to decrease. Now, bone density starts to slowly decrease from about the age of 30, 35. But if you have been really active and you've had a healthy lifestyle from your 30s, then this will be a sort of minimal, sort of slow reduction in bone density. If you have an unhealthy lifestyle, okay, and I'm not saying that in a judgmental way, it's just a fact, then it may speed this process up. So the bone density starts to decrease. So this is where we can see in menopause risk of osteopenia and osteoporosis. Men, as well as their testosterone levels decrease, also affects bone density. Also, what starts to decrease is muscle mass. So this is why there's a lot of messaging out there about increasing strength and resistance training as we get older, because of our fluctuating and reduced levels of hormones such as estrogen. Then this will affect muscle mass, as will nutrition and diet as well. More pertinent to me in my current symptoms is tendon and ligament issues. Okay, now this is due to a reduction in collagen. Tendons and ligaments tend to be tricky to treat and heal anyway because of the reduced blood supply. So it can take a long time to heal tendons and ligaments, even out with menopause. Okay. So my current injury is going to take between 2 and 4 months to heal, probably because I didn't make the link earlier and I've been probably ignoring it for a little while as well and pushing on. So that was my learning curve, and I'm looking to rectify that, and I'm going to tell you how I'm looking to rectify that in a minute. Okay. Another thing that can affect women during menopause and perimenopause, I'm going to say menopause, just take into account that includes perimenopause, okay? Increased inflammation. Now, I'm going to do a whole episode on inflammation and the impact of inflammation on health. And inflammation can be healthy, okay? We need inflammation in the body with regards to the immune system, okay? But chronic, sustained inflammation in the body is probably the main cause of most of the non-communicable diseases we see today. But increased inflammation during menopause can lead to a lower pain threshold, and it can increase joint pain and muscle aches. So in my head, when I was reading that, I was like, well, that makes sense, okay, as to what I am experiencing currently. And interestingly, and this is purely anecdotal, I've not got any research or data to sort of corroborate this, but many of my friends and colleagues, where I work with an age range of probably between, and predominantly probably between 40 and 60 is probably the most common age range of where I work, the job that I do. So a lot of my friends and colleagues are experiencing perimenopause and menopause, and a lot of them are experiencing symptoms of foot pain, so in particular plantar fasciitis and Achilles tendonitis as well. So I've been doing a little bit of reading because I'm quite interested at the minute in foot health. And this is what I think is important in health. It takes you on your own journey, and I would really encourage everybody to become curious. Become curious about your body, learn about it, okay? Even at a really basic foundational level. Know how the body works, because it can really inform you and help you to determine where you are in terms of your own health. So yeah, so this is the way I tend to do it. I tend to end up going down rabbit holes and really delving into the anatomy and the physiology to see what is going on. So the musculoskeletal system is complex, and as I said, it does involve more than muscle and bone. So as a yoga teacher as well, I'm not doing much in the way of teaching in the minute, just to be clear and honest about that. But a lot of the knowledge that I have learned through yoga and through the practice of yoga, I became really interested in working with the fascia. So the fascia is part of the musculoskeletal system. And remember, keep in mind when I talk about a system, it's a system of many systems, and they all work in tandem with other systems in the body. For example, the bone marrow is essential for making red blood cells, okay? And so although I'm talking about the musculoskeletal system, it is connected obviously to the body and the other systems as a whole. But anyway, I'm going on a tangent, I need to stick to script. So working with the fascia is a continuous layer. It's like a sheath of connective tissue. So I had someone recently describe this as like an overlapping of cling film, and sort of that's what it looks like, which is quite accurate from what I've seen. So it was once thought to be just a layer of covering that covered muscles, for example, but we now know that it's a whole organ in itself, and it connects throughout the whole body and actually communicates through the whole body, which I think is beautiful. And I do find anatomy beautiful and fascinating. And with the fascia and fascia health, so if we look at hydration, so if we're not adequately hydrated, and there are images on Google. If you just Google dry fascia, you can see that it can become dry, thick and sticky and brittle, and that can affect your mobility. So even if you look at something like hydration, drinking enough water, okay, can affect the fascia to the point where it can affect your mobility. So it's just to give you, and I'm going to give you examples of what I'm doing in terms of non-negotiables, daily foundations of health to support my musculoskeletal health at the minute. And as I said before, I can book an appointment with the GP, and that option is still open, because one of the options for me would be synthetic hormone replacement, sort of HRT. So not there at the moment, not ruling it out. Gonna see if I can look at my health and lifestyle and what I'm doing on a daily basis first, okay? So I'm not saying that I am against going to the GP. It's an option, but I'm going to see what I can do about it first. So what am I doing? I've had to adapt my exercise routine. So I've had to pause my daily walks. So I used to enjoy, and I still do, and I'm, hopefully I'll be able to do it again, going out for, short, long walks, because walking's great, isn't it? It gets us outdoors, gets us into the fresh air, gets us exposure to daylight and sunlight, but I've had to pause that for now. So what I've done is I've switched in swimming, because swimming is non-load bearing, and it's a bit nicer on my joints. So I'm going to factor in going swimming 1 to 2 times a week, and that'll also improve my cardio capacity, and swimming's really good for lung capacity as well, increasing lung capacity. I'm continuing with yoga and mobility exercises, but I'm adapting some of those deeper stretches. So I would be somebody that would really like to get into those deeper lunges, deeper squats, really getting into the sort of dorsiflexion of the foot, sometimes working with tennis balls and foam rollers and things like that. I'm easing off on that. I don't want to do anything that's going to aggravate the tendons and ligaments. So I'm opting for lighter yoga practices and mobility exercises, but I'm keeping them in there because it's important to sort of maintain that sort of flexibility. Strength and resistance. So I do weight training, and I love weight training. I love it more than any other exercise that I do. I love the technical aspect of it. I like working out my percentages and personal records. And what I've noticed with weight training, I've had a couple of strange reactions when I say that I do weight training, and I think there's been this really weird, can't really get my head around it, judgment about people who weight train, and it's become almost political and ideological, and I tend to blank that out, but it's just an observation. Don't let it put you off, okay? The gym can be a great space for like-minded people, and there's a great buzz and energy usually in the gym. It's quite motivating. Equally, if you don't like weight training and you don't want to go to the gym, that is absolutely fine as well. I think we need to get away from that almost tribal mentality when it comes to health, exercise and nutrition. You do you. So for me, I'm keeping in the strength and resistance, which is in the form of weight training. I also use resistance bands as well. But because of the issues that are going on in my ankle, I'm focusing more on core and hip strength. So by building strength within the core, not only will it help me with my balance as I get older, and this might sound strange, but it also helps with lower limb and foot health. Okay? So just as the glutes help with support back health and core health helps support back health, okay? So I'm keeping that strength and resistance in there. I'm just going to step aside from some of the deeper squats and lunges, okay? In terms of nutrition is key here. So I've noticed as I've gotten older that I've become very sensitive to pro-inflammatory foods and drinks, okay? So what does that mean? So there are quite a few things that I've taken out of my diet. The big one is alcohol. So I stopped drinking alcohol. I'm completely teetotal and sober, and this is going to be a permanent thing. And this was in January 2025. I had my last glass of wine. Because what I found is that my body was reacting negatively to alcohol, even small amounts. I was suffering with gut issues, and I just felt inflamed is the only way I can describe it, okay? Equally, if sort of veer off the path, and look, I'm not holier than thou, I'm not perfect, and perfection is not the goal here, but it's just being aware, and this is where that connection to self is really important, because you become really sort of attuned to, and your body will tell you what's good for it and what isn't. So if I eat pro-inflammatory foods like ultra-processed foods, sugary foods, refined carbohydrates, so white rice, white bread, white pasta. Bread I'm not too bad with actually, but certainly some of the other refined carbohydrates, pastries, can't eat them. Here in Scotland, they love the pastries, they love the bakeries, there's bakeries everywhere. Pastries, I can't eat them, it gives me heartburn. I think a lot of them are made with hydrogenated oils, margarine, things like that, which margarine is not a food, by the way. It's like a chemical layover from World War II. Just wouldn't even go there with margarine. Anyway, I digress. So I've noticed that if I do eat pro-inflammatory foods, that my body responds, and usually it responds in terms of muscle aches, pains, joint pains and things like that. So my symptoms increase. So my focus currently at the moment is on increasing anti-inflammatory foods, and I will do a whole episode on what that means. what do we mean by anti-inflammatory? What is the evidence to support this? But anti-inflammatory foods and an anti-inflammatory lifestyle. So it's not just about what we eat, it's how we live. So you can just Google anti-inflammatory foods. It will give you a whole list of things, and it's the things that you know already. It's fresh fruit, fresh vegetables. I'm really focused on eating seasonally at the minute, because if you eat in tune with the seasons where you live, your body is going to get a really good range of nutrients over the course of the 12 months. It's really good for your gut and the gut biome if you do that. But also thinking about an anti-inflammatory lifestyle. So it's all very well and good eating healthy foods, but if your lifestyle is inflammatory, then, it sort of cancels the other out, doesn't it? So I'm going to talk about stress. Now, the physiology of stress is really interesting. And again, I will do a whole episode just on stress. So in relation to inflammation, it is one of the major causes of chronic disease as we know it today. And there are healthy aspects of stress. So exercise causes stress in the body, but that's healthy stress, as I call it. Dopamine, which is a neurotransmitter, is actually the body's reward system for doing the hard stuff, okay? So it's not, we refer to dopamine as sort of quick hits, on social media, or a sugar fix, or, maybe towards the more intense end, using drugs and alcohol and things like that. Dopamine is actually the body's reward system for doing the hard stuff, okay? So I'm not suggesting here for 1 minute that you must avoid stress, because we can't. That would be absolutely impossible, okay? So, if somebody says to you, you need to reduce your stress, that can be pretty unhelpful, can't it? But we can choose how to respond to stress, okay? And this is where emotional awareness comes in. And as I said, I'll do a whole episode on emotional awareness and emotional intelligence, because it's fascinating how you can physically respond to emotions. It's even thought now that we can store emotions in our tissues as well. So when I've been learning about the fascia, this becomes more evident. Emotional health it does require self-awareness, and a really good tool for self-awareness and learning about yourself is reflection. And maybe I'll do an episode on that further down the line. We use reflection and reflective tools a lot in nursing, and it's a really useful tool to use. In relation to emotions, I do use an emotion wheel. You can just Google it. There are free images on the internet that you can use. So it'll give you a wheel of emotions, and you can actually track. So if an emotion comes up, the body's response to an emotion physically lasts about 90 seconds. So you can, if you're feeling emotion come up, you can sit with it for 90 seconds, let it process. So it's not about inhibiting or blocking emotions. Let it come up, let it come to the fore, let it process, and then, you could be doing some breathing, quiet, whatever you're able to do at that time. And then you can look at, well, what was that has just come up? Why has that emotion just come up? And you can track it to see what's causing that emotion to come up. So that's a really brief, simple overview of emotional awareness, okay? But there are certain stresses, I would argue, that can be avoided. And some of these, I almost visualize this as like a low hum of stress continuously throughout the course of your day. And these are the things that we are all becoming more aware of. So doom scrolling, for example, scrolling through your phone. The phones as we know them now, these handheld devices, were designed to be addictive, okay? Though because of that dopamine hit, I think we are distracting ourselves continuously. I think there's a fear of missing out on things, so FOMO as we call it. And it's really starting to, and the evidence is starting to show that there are correlations between phone and device use and poor health outcomes. Now, out of all the things that I'm doing, going to the gym and everything else, this is the one that I am struggling with the most. And I keep making personal promises to myself that I am going to reduce the amount of time I spend on my devices. But sometimes it's almost like a default, so that self-awareness needs to really be in place so that you can disrupt that need, that thought, that reaching for the phone. And it is challenging, and I would challenge you. And if you're doing this already, if you are limiting the amount of time you spend on your phone, amazing, and it will help with your overall health. But if you're struggling with this, or it's not something you've thought about, so something that I'm going to focus again on, because I've slipped right back, is not looking at my phone within the first hour of getting up in the morning, and making sure that I'm not looking at my phone at least an hour before sleep. So I was getting into a really good routine of reading before sleep, but I've sort of defaulted again. There's so much going on in the world, isn't it? And I think that fear of missing out and need to keep on top of things is what's probably sucked me back in again. But I'm aware of it, and that's important. If you've got an awareness of it, then you're more likely to be able to do something about it. Other stresses that we can avoid are making sure that my body is hydrated, okay? So not being hydrated will put stress on the body. Again, it's individual. I'm not going to say to you go and drink 2 to 3 litres of water, because that would be unrealistic, and it would be a bit negligent of me to do that, because some of you out there might be on restrictions because you maybe got kidney issues, some of you, and it depends on weight, it depends on body mass, it depends on how active you are. So I'm going to be going to the gym later today, drink more because I'm going to the gym and I'm going to do a workout. So it depends on your level of activity, it depends on your age, it depends on your weight, it depends on your height, it depends on your health, okay? So you need to determine that for yourself. But for me, I drink, and I aim to drink, between 2 or 3 litres a day. And you want to make sure that when you urinate, that your urine is nice and light straw colour. If it's dark or concentrated, then that is a sign that you're dehydrated. I'm also going to make sure that my body is nourished, so I'm paying real particular attention, as I said, to eating more anti-inflammatory foods. And eating regularly as well, because I want to make sure that my body is adequately fueled. So today I'm going to be working out at the gym, so I'm going to be making sure that I'm getting enough protein, that I'm getting my healthy fats, and I'm also getting some carbohydrates as well, but more complex carbohydrates in the form of fruits and vegetables, okay? Rest is equally as important. I think rest is an aspect of health. We're in this sort of weird culture of if you go on social media, there's lots of people saying, you must do this and you must do this, and we're a very sort of highly productive, focused society, aren't we? We've almost lost the art of rest, and rest is equally as important as movement, okay? And rest can be movement, okay? So going for a nice slow walk, or doing a bit of nice regenerative, restorative yoga, some breathing exercises, that can be quite restful, reading a book as well. But rest is important. So this is where sleep and the quality of sleep also becomes a priority. So I always aim to get at least 8 hours sleep a night. That's what works for me. But it's not just about the amount of sleep, it's the quality of sleep as well. So when the body is asleep and at rest, it can repair and it can heal. So also to enable this, I try not to eat 2 hours before sleep, because if I continue eating up until the point that I go to sleep, the body is then busy trying to digest food, which takes a lot of energy, okay? So the body uses a lot of energy to digest food and to metabolize the nutrients and absorb nutrients into the body. So yeah, so it's putting the liver is doing a lot of work with digestion and the gut. So by not eating about 2 hours before I go to sleep, it means that when I'm asleep, I'm going into a more of a fasted state, and that my body can focus more on those repair processes and healing the body. Okay, so that's why sleep is so important. Equally, my physical environment is important. So aiming to limit toxins in the home. So cleaning products that I use, cosmetic products that I use. Also aiming to have an uncluttered environment where possible. Now, I don't live in a clean, sterile space. I like my home environment to look lived in, okay? So, in our living room we have, guitars, and my husband plays keyboard, and we've got books, and we've got things that, it is lived in. It's not clean, sterile, and at times it might be a little bit cluttered, but I try to keep, like my office here, I try and keep it as decluttered, so your physical environment can be distracting otherwise, can't it? I also want my home to be quite calm and welcoming for not only me but for my family as well. So when you shut the door and you come in at night, or from wherever you've come in from, you can shut the door, take a deep breath and relax, okay? In terms of my environment as well, I live in Scotland. Now, at this point of the year, this is the 2nd of April, so we're heading into spring, end of winter. I can absolutely guarantee, if you've not been supplementing with vitamin D3, you will be absolutely vitamin D deficient if you live north of the equator, okay? Now, vitamin D deficiency will require a whole spotlight episode on its own. The research and evidence around vitamin D and the benefits and the uses of vitamin D is fascinating. So if you've not been supplemented with vitamin D, then you will absolutely be vitamin D deficient. So I've been supplementing with vitamin D3. Now, I'm not going to prescribe to you what you should be taking. You need to go away and do that research for yourself because it depends again, okay? So I'm taking quite high doses of vitamin D. Alongside that, I'm also taking K2, vitamin K2, because what vitamin K2 is, it will prevent the calcium sitting in the tissues, okay? So it will help absorb calcium into the bones. And so that is my decision that I've made based on my research and my body, okay? But it's something that you need to consider. So in terms of the musculoskeletal system, symptoms that can occur because of vitamin D deficiency, you can get sort of muscle and joint aches because of that. So if you think about rickets, in children, it can be a condition brought about by vitamin D deficiency. So vitamin D helps with calcium absorption as well. So you can see how it might affect bone health as well. The best way to get vitamin D is daylight and hopefully sunlight. So I'm here in Scotland. It's nice and bright and sunny today, but it's extremely cold. It's not extremely cold, it's cold, but the weather's not been great in recent weeks. It's been very cloudy, very dull, very windy as well. So daylight, you can get vitamin D any part of the year in daylight, but it's going to be less or more dependent on if the sun is out and the level of the sun. So sunlight is absolutely the best source of vitamin D, but because we don't get enough sunlight in the sort of northern hemisphere, then it's a good idea to supplement. So in addition to that, I'm also eating a couple of portions of oily fish a week as well. Yeah, so this is also important in terms of my musculoskeletal health. So you can see how we can do so much to support our health, and it does require a bit of effort, it does require commitment, but it is extremely empowering, okay? So having sovereignty over your own health is really empowering, and I'm saying that from experience. And it may require you going and doing a little bit of research, a bit of reading, adding to your own knowledge. It could be going and doing a course, for example, in anatomy, or just informing yourself. And I know people say, like, go and look at the research, but being able to interpret and understand research is a skill in itself as well. So it can be challenging, and there's lots of messaging out there. Finding a source of information that you can trust, can be challenging as well. So I'm just trying to share with you my knowledge and my experience to hopefully inspire others to do the same. So my aim as I age is to remain as independent as I can for as long as I can. So maybe if you're thinking about improving your health, a good place to start could be, what is your why? Why do you want to do this? And use that as your focus for committing to do this long term. So I want to remain as independent as I can for as long as I can, so that I can keep doing the things that light me up. So this is what keeps me well spiritually. It's having a sense of purpose. So how I connect to myself and others. And I'm hoping this episode has provided some insight and prompted you to reflect on where you are currently in terms of your own health. And I just want to, there's a resource that I use. I'm not going to share it with you because it's probably under copyright law, but a really good resource that I've used in the past to reflect on where I am is the Wheel of Life. Now, the one I used was produced by the College of Naturopathic Medicine. That's where I trained as a health coach. But again, just like with the emotion wheel, Google it. There'll be other versions that you can find, and you can find one that suits you. And what it does is it gives you different aspects of your life that you can score out of 10. So it's a really quick tool to use. It's really visual. It's great. So you can make a little graph of where you are currently, and it'll give you a visual of areas in your life that might need a little bit of focus at the moment and maybe need to be prioritized. And then you can come up with ideas based on the resources that you have on how you can make improvements in those areas as well. So I found that really beneficial, not only for me, but health coaches use this as a tool, as a coaching tool as well. So as I said, the emotion wheel is the other one. And it's just so that you can start to make small adjustments. And the emphasis is on small, because if you try to go too big too quickly on improving everything, then that is unsustainable. So it's identifying what area of your life probably needs more of a priority. Okay, so for an example, that could be financial. If you've got, what are your finances looking like? Does that need a bit of attention? It could be your relationships. It could be work. It could be your health. So, where needs a little bit of attention currently? And then make a list of small achievable things that you can do on a daily basis. So I had this described to me as like little dials on a radio, when you tune in, or you tune in like a stereo, and you want to get the bass and everything the right level. So it was making little tweaks on a daily basis to build those foundations that will support your health overall. So things like getting outside, getting daylight, making sure you're hydrated, eating as healthy as you can, moving your body. These are all the things that could be your foundations. So start reviewing different aspects of your life, note where there could be some improvement, and make a resource list. So what resources do you have? So that could be things, people, places that you're going to have a little list of things that you can use. And I think that's it, actually. Yeah, I think I'm going to end there. So let me know how you get on, and see how you get on. It's food for thought, isn't it? So hopefully I've given you a bit of insight, a bit of inspiration, and maybe challenge you in terms of your own thoughts, beliefs around health. Yeah. And I'm going to leave it there. Have a lovely Easter. So as it says, the 2nd of April today. So we're just coming up to the Easter weekend. Have a lovely Easter, and I will see you at the next episode. Take care. Bye-bye.